Hi and welcome everyone. Welcome to today's video. If you're new here, we discuss medical topics and lifestyle. In today's video, we are talking about the signs and symptoms of hypothyroidism. So we're going to stick to the signs and symptoms because there's quite a few to cover in terms of causes and things like that. We'll go over in another video, and today we'll focus on this. So let's get started. So before we get into the signs and symptoms, let's start off with some basic function and anatomy. So where the thyroid hormone comes from and what it actually does. This will help us understand why the signs and symptoms occur the way that they do. So we start off in the brain, in the hypothalamus. This produces a hormone called TRH. It stimulates the pituitary gland, which is also in the hormone, in a positive way, and it tells the pituitary gland to secrete thyroid stimulating hormone, TSH. This hormone gets sent to the thyroid gland, which is a gland in the neck, as shown in the picture there, to produce T4 and T3. This then sends a signal throughout the rest of the body, the peripheral tissue, which tells it to convert T4 to T3, which T3 is the more active component, the more active molecule here. Then, when we have plenty of T4 and T3 in the body, this then sends a negative feedback all the way back up into the brain and tells it that enough thyroid hormone has been produced, so we don't need to produce as much anymore. So anywhere along the line here, along this pathway, if there's a disruption, then there will be abnormalities. So for example, if in the thyroid gland, there is something causing the thyroid gland to produce too much T4 and T3, right? Then that will be a negative thing because then that will be called hyperthyroidism. Too much T4, too much T3, and then it sends a feedback loop back up to the brain saying we don't need as much, and then there will be a decrease in TSH. So that's the way it works. In the opposite fashion, this video, so if there's hypothyroidism going on, for example, then in the thyroid gland, the thyroid is not producing enough T4, T3. And then what does that do? That sends a feedback to the brain saying, we need more thyroid hormone. And then that causes it to increase the amount of production of the signaling hormone, TSH. So these can be measured in blood tests and so on, but that's how the thyroid hormone function persists and exists in our bodies. So we have identified where it comes from and how it comes. Now, what's the actual function of the thyroid hormone? So we know that we have a gland in the neck. We know that it produces hormones. So what's actually going on? What does it do? So the thyroid gland produces hormones that regulate the body's metabolic rate, growth, and development. It plays a role in controlling heart, muscle, digestive function, bone maintenance, brain development. So it has a role to play in a lot of things. Its correct functioning depends on a lot of things. We'll talk about it in another video in terms of the causes, but its correct functioning depends on a good supply of iodine from the diet. So it's worth keeping that in mind. So to summarize, your brain tells your thyroid to make more thyroid hormone or less of it based on the TSH levels. Thyroid gland is in the neck, produces T4 and T3. T4 converts to the more active hormone, T3. T3 does all the work. It binds to the receptors and tells your body and the genes that all systems go. It's important that it's working. Think of it as the motor of your body. So if you have a bad motor, bad body, good motor, good body. A lot of influences can be there, so a lot of things can impact it. So, toxins, stress, diet, nutrients can cause the T4 not to be converted to T3. Again, more of that in another video, but that's basically the gist of it when it comes to the thyroid hormone. Now, let's move on to the signs and symptoms. We can have cold sensitivity, so that's one of the most common symptoms as a result of decreased metabolism and as a result of lower core temperature. We can gain weight as a result of that, despite having a reduced appetite, again, caused by decreased metabolism. Constipation. When there's a decreased appetite, there's less movement in the bowels, less action going on, and less function overall of the GI tract. So think back to that motor analogy we said. If we have a slow motor, dysfunctional motor, then all the processes are slow. So we have reduced appetite, cold sensitivity, constipation, and weight gain as symptoms here and signs. So as you can see, there's quite a few signs and symptoms here, and it's quite vague. And that's part of the reason why it goes undiagnosed, because it's very vague. Now, adding on to that vagueness of signs and symptoms, so if you have a bad motor, dysfunctional motor, slow motor, things are going to be slow. So there's a mental side of things here as well. So depression can lead to fatigue, and it goes around in a loop as well. poor concentration, poor memory. So these are all quite common things that can happen, again, due to a slowing of metabolism and cognitive function. It can be a result of the actual depression as well, right? So depression can cause all these other things as well. Um, it, decreased concentration, low thyroid hormone, depression, fatigue, all these things can contribute to it. And again, same thing goes with the memory. So this is quite the vague picture. And especially if you start to add on all these other things we mentioned a minute ago, it can paint quite the vague picture. And that's why it's so important to diagnose this. And then we can get signs that are a bit more prominent physically, right? So things that can bother us when we look in the mirror or feel it in our bones and body. So hair loss is a factor here. So thinning hair, hair loss, dry, scaly skin. So this is a result. The skin part is a result of decreased gland secretion. The hair loss, so increased hair fall and reduced growth. You can get joint pains, arthralgias, in other words, a decreased heart rate, known as bradycardia. So normal heart rate is between 60 and 100. Anything below 60, we call that slow or bradycardic or decreased heart rate. So these are some of the physical signs that can be going on. Now, going forward from that, we can get just general weakness, generalized weakness, pins and needles also. So that's called paresthesia. It can impact our nerves. So we can get something called carpal tunnel syndrome, where it affects the median nerve in our wrist. We can have neck issues that go on. So a goiter can develop. So that's when too much thyroid hormone is being produced and it swells up the thyroid and develops a goiter. This can then cause anatomical issues. So it can press on things in the neck, press on structures in the neck. You can get a hoarse voice, for example. You can get period issues, so amenorrhea, oligomenorrhea. So these are specific things we'll make videos on, but these can happen as well. More serious things like kidney problems can occur. So this is as a result because thyroid hormone acts on blood vessels in the kidneys. So there's a lot going on here, and fluid retention. So that's a big one. So you can get pulmonary edema. You can get myxedema, which is what we call edema in or rather edema caused by hypothyroidism. So that is a non-pitting edema. So when you press it with your finger, it doesn't leave that indentation. Or for example, when you wear socks, it doesn't leave that indentation when you would take your sock off. So there's a lot going on here, quite vague symptoms. And I think I've covered most of the symptoms. If I've missed any of them, please leave a comment in the section below. Thanks for liking the video. Subscribe, and we'll see you in the next one.